You assess the FDA's efforts is put in already to assess the herbal markets, the herbal medicine markets?
Okay, it is a big task, and the Food and Drugs Authority, not Board, we've had various stages of sanitizing the market, and I think we are not fully done, but the authority has made a lot of impact.
What will these impacts be?
Yeah, the final impact should be that whatever herbal medicine you pick, food supplement you pick from the market, should be at a level of quality and standard that the authority is prescribing.
Okay, let's take it step by step. What have you done so far?
We have positioned the industry for future development. What do I mean? You remember, if you cast your minds back a few years back, you could see that the way herbal medicinal products were presented, nothing to write home about. Now we have gradually helped the industry to package properly. We've helped the industry to subject to regulation. Formerly, it was not possible. Now, many manufacturers are subjecting their products to regulation. What do I mean by subjecting to regulation? They are allowing us to look at how they manufacture. So we visit the manufacturing places to assess if they are complying with current good manufacturing practices. 2, we've been able to educate the manufacturers, by way of training on good manufacturing practices, on preservation practices, all the activities that will lead to good products. We've taken some representatives, members of the Manufacturers Association, to countries outside Ghana to see what pertains, so that they can reintroduce it into our system. We've done that.
But that is for the formal sector, those who have registered businesses and have factories and the likes.
Yeah, precisely.
But how about the women on the market who sell herbal medicine? How about the one at home who administers herbal medicine?
All right, let's categorize the herbal medicine industry. We have the herbalist sitting somewhere doing his practice in a village where everybody knows him. He's the medicine man of the village. That person is not manufacturing. He picks herbs, puts them together, 1, 2, and then administer. The response is seen, and then the patient goes home. Okay, so he's not gathering ingredients, some with some chemicals, and mixing them in a box, a container, and labeling it for mass production, for mass consumption. Okay, we are interested in whoever decides to manufacture, put ingredients, 1, 2, 4, 5 ingredients together for mass distribution. You understand? So the woman who is selling those twigs, tree parts, leaves, dried herb, few things on her head at the market is not our main concern. Because these things are not processed, manufactured, or packaged. It is.
But there are some who have those that are actually processed that they sell.
Yeah. If somebody is doing that, I was coming to that. So this is the first category. We don't have much problem with that. After all, you are just buying a twig and chewing it. You know what you get from it. But then where the person has packaged in a bottle, in a package, labeled for many people, then we come in. At the market, if you find somebody with that product, then you want to find out if it is registered, because it should be registered. We also advise that these products are sold in places where other agencies, government agencies with Food and Drugs Authority regulate. You understand? If it is a herbal medicinal shop, health shop, pharmacy shop, these places we go there and regulate. But then in the market too, we don't have a problem people selling herbal medicines in the market, provided they are registered. Manufactured products are registered.
One of the biggest signs a lot of consumers know when it comes to ascertaining or proving that a product has gone through the FDA or the Standards Authority is the embossment. The embossment which could be replicated at any time, anywhere at all. How else can a consumer ensure that what I'm consuming, this manufactured product I'm consuming, is indeed, or it can give me it can provide the service that for which I'm buying it?
Yeah, you're talking about the embossment of either logos or numbers.
Or numbers.
They in themselves will not assure quality. Okay, so the focus is on how the product is manufactured. It is not anything you find that you patronize.
Okay.
It is not any product that you find on the market that you patronize. Even if you want to do that, what are the signs to assure you of the product quality? Look for obvious errors in diction, obvious errors in dosages.
But you can't blame the Ghanaian herbalist for getting the spelling wrong.
Yes. When it has gone through the Food and Drugs Authority scrutiny, we check for all those.
But that is a sample. At the end of the day, they would have to do mass production.
Yes, during the mass production, I told you we visit the manufacturing plants and we regulate that. Okay.
Even the printing.
Precisely. Good manufacturing practices include the packaging.
I see.
So Food and Drugs, if we have seen that product, will not bear those errors.
The product,
serious errors on the on packaging.
On the product,
English.
The grammatical error.
Precisely. That is a good indication that the product has come through regulation. So and then the quality of the packaging. If you see a package that is cut, not carefully cut, all these things, because if it has gone through regulation, these are errors that are corrected.
At all those things.
So that's one thing. Two, we encourage manufacturers to package it in a way that the integrity of the product can be assured. And so if you find a product that is bloated on the shelf, a product that is leaking on the shelf, that is an alarm bell that should tell you that there must be something wrong with the product. Okay. So the technical identifications belong to us. But if somebody puts a logo on the product, if somebody puts a registration number on a product, that alone is not enough to assure the quality, because it can be faked, like you're saying. Scratch cars, whatever, they are not foolproof. The only thing that you want to look for is one,
signs of
distortion, signs of poor packaging, signs of poor preservation. Okay, all these things will tell you that the product is not done properly, and so you need to raise.
How many of these companies do you work with? Have you covered all of them?
The law says that all of them should come to us. The law says that if you want to manufacture these products, go to Food and Drugs Authority for registration, which is the regulation. If they don't, we have a strong market surveillance team.
That is when it has got to the market already.
That's the only place we can detect it. And then we have we work with the other state security agencies. So we get reports from the police, we get reports from the BNI, we get reports from national security. Everybody is cooperating. But we want to encourage citizens, Ghanaians, all of us, to be part of that team. A part of the team that is reporting to Food and Drugs Board. Because if you bought a product and it does not meet your requirements, it does not meet your quality requirements, and you do not tell me, you do not report to Food and Drugs Authority, nobody knows.
I see. Somebody
could be hiding somewhere and then churning these products. So if you make a simple call to Food and Drugs Authority, then somebody follows up. The market surveillance follows up.
When you spoke about those who are not manufactured, it includes those who sell the tree parts and the little herbs in vehicles.
Precisely. Once it is those twigs and leaves and they are not packaged and processed, we do not come there. But people sell these manufactured products, products that are supposed to be regulated on vehicles. But then the authority has tried several times to stop that practice. It's not easy. But then let me send this caution. If you are a consumer, a Ghanaian, and you bought a product that is going to treat your cancer from a moving vehicle, and the product turns out to knock out your liver, whom do you go to? You have nowhere to go.
That's a tough one.
Herbal medicines, just like orthodox medicines, have also side effects, and some can be very serious. So if I bought it from Mami Oti Herbal, and I can go back to Mami Oti, it is the best. Because one, if it doesn't work, you need to go back. If you do not get the desired effect, you have to go back. If there are untoward effects, you go back.
You go back, indeed.
Are you going to search for the vehicle at Kajetia or Kantamanto? You will not. So we advise that buy medicines, herbal medicines, orthodox medicines.
I remember also at the beginning of the rise in the use of herbal medicine to cure our illnesses, the FDA was pretty much concerned about some medicines that claim to cure all kinds of diseases. How have you been able to sort that with the traditional medicine practitioners council? Yeah, we did. The council cooperates with the Food and Drugs Authority, and we work together. We moved from that state. We moved away from that state. So now what are the requirements? You agree that some of the medicines can do a lot of things?
No, the requirements is that if you state that your product can do A, B, C, D, E, F, many indications, all that we want from you is to prove efficacy, prove safety. If you can prove that, we don't have any problem rejecting your product. You need to prove, and proving it is scientific. So for manufacturers, it's better to have one ingredient, one or two ingredients that you're sure of what it does.
What happens with herbal medicines that require faith to be able to?
That goes into another realm of practice.
That does it, but it's herbal medicine. But you and I know that as Ghanaians and as Africans, we do have some herbal medicines that only work with faith. I mean, let's not downplay it and say it is herbal medicine package, all right.
Under the Traditional Medicine Council, they have an area, one branch that deals with the faith issue, medical, religious. They have another place. We deal with science.
I see.
The Food and Drug
so
Authority
that it doesn't fall under
it doesn't. In fact, we don't have the
even
tools.
though it is manufactured and processed and packaged and all that.
No, you cannot manufacture and process and claim that out of faith is going. No. Once you manufacture and package,
so
then
when
you
we
need
see
to prove
something like that,
we should let Food and Drugs Authority
I see.
know.
Thank you very much for your time here.
All right.
Absolutely fantastic talking to you.
You're welcome.
We'll find a better time and then expand the conversation.
Yes, we need to, and we have a lot to let the industry know. The Food and Drugs Authority has what it takes to bring the industry to the next level. We brought them to where it is by starting regulation some few years back.
And now we have herbal clinics.
Herbal clinics, beautiful health shops, nicely labeled products tested and found to be efficacious, some of them. So we encourage everybody to come under the net. We're going to move to the next level. That's which will be putting some credibility into the products that they manufacture, so that they will have credibility outside Ghana, credibility inside Ghana.
How do we do that?
How do we do that? I started by talking about scientific testing. If we are able to subject our products to clinical trials, phase 1, phase 2, maybe phase 3, then the whole world is assured that this product can do what it claims it can. That's the only way forward. If we're able to do that, then manufacturers of our business, those in the herbal medicine business, are going to make a lot of money. It is going to impact on Ghana, impact on employment. So we need to look at that area.
We look forward to that future.
Thank you so much. Absolutely.